Medical Monday is sponsored by Beaufort Memorial.
Breast cancer will affect 1 in 8 women in their lifetime. So here to talk about this very important topic, our board-certified, fellowship-trained medical oncologist, Dr. Eric Turner, and nurse practitioner Katy Jones, who sees patients at Beaufort Memorial Oncology Specialists in Beaufort. It's nice to talk to you guys. Now, there have been so many advancements in breast cancer detection and treatment over the years, which is so encouraging. But what do we know now about being high risk for breast cancer?
Well, what we know is that there are different risk factors for breast cancer. Some of them are modifiable, some are not. The ones that you can't really control are age. As with any cancer, the older we get, the more and the higher our risk of developing cancer. And breast cancer is really no different. There's also factors such as having dense breasts that put us at increased risk. You can't control family history. Unfortunately, you just can't control that. And then the other big one, I think, for risk factors that you can't control would be genetics. There are certain mutations, we know there are cancer genes that put us at increased risk. And if you happen to harbor one of those, it's just not something that you can control. There are factors that you can modify. And most of those are lifestyle. Obesity puts you at increased risk of breast cancer because of higher internal estrogen levels. So sedentary lifestyle, we have to move. Every study that's looked at that says stay active, stay moving. Other risk factors, alcohol and tobacco. Most people don't really realize that as we think about lung cancer, but it actually is a risk factor for breast cancer as well.
Okay, now let's talk about genetics, Katy. How do you know if you're possibly more genetically at risk for developing breast cancer? What's the latest information that's out there?
Family history, family history, family history. So anytime someone is newly diagnosed in particular, or even often when they're working with their family doctor on regular checkups, family histories are important. If we see multiple people on one side of the family with malignancy, particularly diagnosed at early ages, it's important that they have counseling and testing. So part of why we do genetic testing is because the people who are positive for a genetic mutation, which is different than their family history, but if they have that genetic mutation, they're a very high risk group. Thankfully, it's a small number, probably 5 to 10% of people, even who have a personal diagnosis of a breast cancer, have a genetic mutation. But we check even with those small numbers because we do their treatment differently.
And let's talk about early detection, because that is so important, really, in any kind of illness, especially cancer. But why specifically with breast cancer?
It's all about cure. As with most cancers, the earlier you can find the cancer, the higher our chances are of curing. And if you look at sort of the literature and the data for that, if you can catch it at an early enough stage 1, very early, 5-year cure rates are as high as over 95%.
Wow. Okay, now let's talk about early detection. What are the best ways to catch it early then?
Well, the gold standard is mammography. Yearly mammograms are absolutely essential. Other things you can do, obviously, are self-breast exams. You should do a self-breast exam basically once a month. No one knows their breast better than the patient, so you're looking for certain changes, lumps, dimpling, retraction, discharge from the nipple, those sort of things. So if you see any of that, you need to see your doctor. A clinical breast exam, we typically recommend at least once a year. You have either your primary care physician or your gynecologist do a clinical breast exam as well, in addition to mammography.
And that's pretty standard with your yearly visit, isn't it?
It should be, yes, very, very standard.
All right, well, Dr. Turner, you mentioned mammograms. At what age should women start getting those mammograms? What's recommended now?
So the guidelines have changed in recent years to some degree, but currently I think most organizations recommend, if you're at average risk, initiating your mammography program at age 40. If you're at higher risk for whatever reason, we oftentimes recommend starting earlier than 40, but sort of general guideline is at age 40.
Some women may experience dense breast tissue, in particular in a reading on their mammography. And what we do to better evaluate dense breast tissue is recommend additional screening measures like advanced breast ultrasound or MRI, so we can get a really good picture no matter the modality.
Yeah, and Katy mentioned MRI screening. If you are at high enough risk, there are certainly patients that we recommend alternating every 6 months a mammogram with an MRI. The reason for that is that when the breast tissue is so dense, you can, as Katy mentioned, the mammogram can have a difficult time picking up very small lesions, the MRI is much more sensitive at that.
Okay, well, bottom line, there are really great ways to detect breast cancer, and the early detection, of course, the better your chances of surviving, as we mentioned at the beginning of this. All right, well, Katy and Dr. Turner, thank you so much for talking with us today. And if our viewers have any questions for them about their program, you can always go to beaufortmemorial.org/breastcancer. All right, thank you.
Thanks for having us.
Thank you.
In recognition of Breast Cancer Awareness Month, Beaufort Memorial is offering screening mammograms for just $99 during October. Purchase your voucher by October 31st and use it to get screened anytime in the next 6 months at one of 3 locations in Beaufort, Okatee, or Hilton Head Island. Early detection is the best protection. Visit beaufortmemorial.org/saveonmammos to learn more.